So welcome to 84U. We are going to discuss a letter today. So the letter is received from our group. So just correction that we are going to explain here. So the letter is regarding Mr. George Gale, and most of you already read the case note. So just read the case note in 5 minutes time and take another extra 5 minutes to plan your letter and write. Okay, so writing task is clearly mentioned just below the letter. So it's about a letter to infusing the information. The case notes: write a letter of discharge to Miss Gold, the head nurse at Primrose Nursing Home. So in your letter, briefly outline Mr. Gale's history as well as your concerns and recommendations. Okay, we'll see the letter now. So the date is fine and Miss address part is good. Okay, so then Mr. George Gale, 85 years. In introduction, there are some corrections. So here is not needed because you're already writing regarding Mr. George Gale in top of it. Okay, so Mr. George Gale, who was admitted in a hospital on 10th May 2021 by his neighbors, is not that much important information, that more irrelevant information. Okay, after a fall on 9th May 2021. Again, you repeated after a fall, so just correct that word. So, at his home where he lives alone, and full stop. Because in your introduction, there is no purpose is mentioned. So, we added a purpose in that he requires follow-up care and management, and he is ready for discharge today. Okay. So, the second paragraph. Mr. Gale, on admission, showed signs of disorientation and fever. He reported an episode of vomiting, palpitation, and dysuria 2 weeks before fall. Full stop. You've given one incomplete information. Okay. So after that, what happened in the hospital is another important thing. So on observation, his vitals were abnormal, and an urine analysis was done which confirms urinary tract infection, which was treated with IV amoxicillin 750 mg 4 times for 4 days. So the treatment, appropriate medical management was provided is okay, but you should explain what management you had given to the patient, because that is an important information the nurse needs to know in the care home. Okay. Again, the third paragraph is about the history of the patient. Mr. Gale's medical history shows that he has been suffering from osteoarthritis. So from here, I'm going to club the informations with the information in the fourth paragraph. Okay, so Mr. Gale's medical history shows that he has been suffering from osteoarthritis, for which he takes paracetamol 500 mg 4 times a day for osteoarthritis. So you don't need to write it again for osteoarthritis. This you can add to the previous paragraph, and he takes felodipine 5 mg for his hypertension, then full stop. And he also diagnosed with non-specific colitis since 2003, or since it's not since 2003, it is 2019. Okay, so that's the paragraph for that. Okay, so that paragraph, you can club that two informations into your one single paragraph. And the last paragraph is Mr. Gale insists on returning home. That is right, but however, temporary care is required. Why that temporary care is required? Because you should mention concerns like he lives alone, independent, no family nearby, and still exhibits signs of confusion. You mentioned in the last sentence, and signs of confusion, and therefore assessment for independent living needs to be done, and therefore he requires follow-up care. That's why he is transferring to the care home. So that you have to write in your last paragraph. That is the completion of the letter. Then you can write. Okay, so this is all about second, third, fourth paragraph, then the last paragraph. Then you can write, please contact me with any queries. Yours sincerely, and you can finish that, and your name would be registered nurse or something. You can put that. Okay, that would be lovely. So there are some corrections that you need to be aware of. So you need to write If you want to rewrite the letter, write the letter and come back to us. All right. Thank you.